Hi, I'm Dr. Katie Beleznay. I'm a board-certified dermatologist with a fellowship in cosmetic medicine. One of the emerging areas in cosmetic dermatology is facial rejuvenation treatments for men. A survey done in 2013 by the American Society for Dermatologic Surgery showed that men accounted for 11% of the overall total for injectable neuromodulator procedures. And while this is still a small number relative to women, the number continues to increase, and cosmetic treatments for men, sometimes known as Brotox, has become a hot topic. Today I'm going to talk a little bit more about neuromodulator treatment for men and demonstrate the treatment of a man's face with a neuromodulator such as Botox. So the area of the face commonly treated in men are the frown lines between the brows, often referred to as the 11s, crow's feet, and the forehead. Men typically require higher doses of neuromodulator than women because of their larger facial muscle mass. Treatments performed on the male face are aesthetically and technically not the same as on the female face, and using the same techniques as we use on the female face can really lead to poor results. So the anatomy of the facial muscle in men differs from that of women, with significant variation in the frontalis or forehead muscle. In addition, it's important to keep in mind that men have a more horizontal, less arched brow that is flatter in contour, giving the face a more masculine look. This feature really should be preserved to avoid feminizing the face. It's also important not to overtreat the depressors of the eyebrow in an unbalanced manner, as this can result in an overly arched brow. But at the same time, men often have lower set brows, and so you don't want to overtreat this frontalis muscle or the elevator of the brows, as then the eyebrows can become even lower. Many men want to soften their frown lines, as furrowing of the brow can result in an angry look, and that can negatively influence people's perception of them in both business and personal settings. Unlike women, who often request a more noticeable reduction in their wrinkles, men are generally looking for a more subtle treatment. The goal is a natural result that will help to soften the frown lines and wrinkles. The patient will notice a decrease in muscle contraction and wrinkle formation within 3 to 7 days, with results generally lasting 3 to 4 months.